most of our prevention focus and all of our testing is really focused on these persistently infected animals.
Welcome to the Beef Podcast. I'm one of your hosts, Brandy Buzzard, and it's my pleasure to bring you the trending issues and topics with the best and brightest minds of the beef industry. Today, we are welcoming back an old friend to the podcast. We are honored to once again have the renowned and respected Dr. Bob Larson on the pod to celebrate our 30th episode. Dr. Larson is a Coleman Chair of Food Animal Production Medicine at Kansas State University, where he's highly involved with teaching and research focused on beef cattle health and production. A fellow podcaster at the Beef Cattle Institute Cattle Chat podcast. Please help me welcome Dr. Bob Larson back to the podcast. Welcome back, Dr. Larson.
Well, it's good to be here.
Yeah, we are glad to have you back, a familiar face, and a very timely topic. Last time we spoke, for those who have not listened to Dr. Larson's our inaugural episode, we talked about a lot of different things. There was drought in there. There was waving magic wands to fix the beef. There was a lot of things in there. So I encourage you, if you haven't listened to that episode, to go back and give it a listen while you're making hay this summer. But this time we want to focus a little bit more on BVD, or Bovine Viral Diarrhea. I know that that's one of your focuses and areas of expertise. So we really want to hone in on that. So knowing that, let's jump right in. Actually, for those who don't know who you are, which is probably a rare thing, but there may be someone out there, could you give us, just your background, how you got to where you're at K-State, and then we'll jump in on the BVD.
Sure, I'd be glad to. So I grew up in Kansas and went to Kansas State University for my undergraduate in animal science and then vet school. I then practiced for a little while before I went back into academia and got a PhD in the animal science department at K-State. After that, went back to practice for a few more years, primarily in central Kansas, but a little bit of time in Illinois as well. And then I found myself at the University of Missouri for 10 years. And that was really a great experience, and one where I really kind of did a lot of work with BVD, Bovine Viral Diarrhea, that is then extended onto my time here at K-State. So I spent 10 years in Missouri at the university there, and then I've been back at K-State since 2006. And I do teaching and research in the veterinary college and do kind of some outreach with the industry as well.
10 years here and 10 years there. And then what you said, you went to K-State, you came back to K-State in 2006.
Mm-hmm. So yeah, time adds up.
Yeah, I was going to say your career is pretty lengthy here, Dr. Larson.
Yeah, that's a nice way of saying it.
Oh, I meant no harm. Those years, definitely the experience has racked up for you. Well, thank you for sharing that. Just for those who may not have heard your initial episode or had the good fortune of meeting you yet. But so getting back to the BVD, can you tell us, what is bovine viral diarrhea? And honestly, why is it a concern for cattle producers?
Yeah, so there's a lot about this disease that makes it very interesting and very important. One maybe unfortunate thing is its name, in that although it is possible for animal infected with BVD to show signs of diarrhea, that's actually a rare occurrence now. It got that name because when it really first showed up in the United States in the early 1950s, late 1940s, very serious disease, often accompanied by profound diarrhea and death. The virus mutates, animals build some immunity as the beef herd in the United States builds some immunity, and we don't see that syndrome particularly anymore. But what we do see is a variety of syndromes. One is reproductive problems, such as it can cause abortion, stillbirths, some birth defects. So it affects pregnant animals, both the ability to get pregnant and maintain that pregnancy. It is also a really strong immunosuppressive virus in that it invades some of the important immune-generating cells of the body. And so it just makes the animal more susceptible to other diseases. So on the feedlot side and stocker side, a lot of times we'll see it associated with respiratory disease or bovine respiratory disease, both as a primary pathogen that can cause damage to the respiratory tract, but also just because it can suppress the immune system. So then other viruses and bacteria have a better chance to cause more harm. And so you've got this reproductive syndrome, you got respiratory tract syndrome, and again, as the name would imply, you've also got digestive tract syndromes. So that's actually one of the reasons that BVD virus is kind of unusual, is it affects so many different body systems. The other thing that makes it unique is that it's affecting cow-calf, dairy, stocker, feedlot. It's really no segment of the industry really gets a pass on this disease.
Mm-hmm. I'm glad you brought that up, because that was going to be kind of my next, was a kind of a follow-up, was obviously it's affecting reproductive performance and lots of other segments there. But like, is there any effects on bulls? As like full grown bulls, if you've got like a seed stock producer who's, finishing bulls or developing bulls or something like that, is it rear its ugly head there, or?
Occasionally, probably less there, although we could come up with a couple of exceptions. In that adult animals that are not carrying a pregnancy, like a bull, may be infected with the virus and again have a temporary immune suppression and those types of problems that could lead to some other issues, but not likely to be life-threatening. And usually an adult bull would be able to bounce back from any type of an infection. There's some interesting things, though, that this virus can set up in the testicular tissue and can cause the virus to show up in semen, in the fluids associated with semen, and can pass that way. It's pretty unusual for a temporarily infected, acutely affected bull, for that to be very important or common, but it's possible.
Right. I'm sure there's a situation where anything happens. I had a question in mind. Oh, you said it came here. It was first discovered or kind of popped up in the 40s and 50s. How does something this like traumatic, I guess is the word. Maybe traumatic is, I don't know. How does it just pop up and appear?
I should start and stop with the answer of I don't know, because I don't know. But this is in the family of pestiviruses, and pestiviruses are in many different species. And that's one of the things we're actually kind of keeping an eye on with other pestiviruses besides BVD. So if anybody raises sheep, border disease is a related virus in the sheep side of ruminant. And so in other parts of the world, there's some other pestiviruses. So probably my best guess would be a pestivirus in some species, possibly even in cattle, mutated and became much more aggressive. And that's kind of where we got the disease we have today.
I see. You mentioned that it doesn't travel together with BR. I think you said BRD, but it's an immunosuppressant. Or are there other diseases that are more likely? Is there a higher prevalence in another disease when something has BVD? Meaning, like, is there one disease that is very likely to be going on at the same time, or is it just kind of happenstance? Or
it's kind of whatever else is the biggest problem in that herd. So just think of BVD is one of the things it does is just suppresses the immune system. So the other problems that the herd might be confronting at the time are what are going to show up. I've seen it, show up maybe in more foot rot than you would expect, or definitely more respiratory disease than you would expect. So basically, any other problems, if BVD is circulating in the herd, it's probably going to be worse.
Okay, so just the disease of the du jour,
I
guess.
It's kind of disease of the day, whatever is there, shows up worse.
Great, that's just lovely. How can producers detect it? Like, what are the easy symptoms to identify? Because sometimes there's something that could be a symptom that could just be an environmental issue. Like, we're in a drought, it's really dusty. Is coughing a symptom? Are they coughing just from the dust, or are they coughing because some other underlying issue? So, like, what can producers look for to determine if they maybe do have BVD? And if they suspect that, should they test? Kind of, maybe, can you give some insight there on that?
Great question. And because one of the main ways that BVD shows up is just it suppresses the immune system, so other things show up. A lot of times there's not any one specific thing to look for, but there's a couple. One is BVD causes a birth defect that is pretty unique to BVD. It causes the back part of the brain is the cerebellum, and it'll be, if you do a necropsy, it's small and it didn't develop right. And these calves often can't stand, won't stand, failure to thrive, definitely. And that's very specific, almost uniquely for BVD virus. So if you get one of those calves, and a lot of times they're kind of associated with some other things, kind of a domed head, sometimes a short lower jaw, those types of things. Now, that's, again, there's a few other things that can cause those kinds of looking calves, but that would be a reason to start looking for BVD. The other thing is because BVD has been around for a while, the national cow herd is pretty well exposed. We have fairly effective vaccines, and so it's not common to see a completely naive cow herd. So the reason that is important is so that the problems we see are kind of subtle. A few animals, maybe the younger animals, maybe the animals that didn't have as good immune protection, they might be affected, and other animals are not. So it's looking for higher than expected respiratory disease based on other risk factors, or anytime that my reproductive performance goes down or a few more abortions, BVD is on my list to look for. And by looking for, we actually have some nice diagnostic tests. And we can identify the virus in blood, in serum, and we can also identify what we call a persistently affected state in skin tissue. So people are probably familiar with, taking an ear notch or other skin sample and looking for the virus in that. And that is a nice diagnostic tool that we have to investigate problems.
You touched on this. I believe you just touched on persistently infected, and I want to talk about that real specifically. But can you kind of, before we get to that, so from what I'm understanding is that you may not have a clue that there's BVD in your herd, like active, until one of your calves hit the ground and they look pretty off.
Yeah, that's actually true. A lot of times I've been involved in some situations where we'll do some screening, either for marketing purposes or research purposes or those types of things, and we'll identify a herd that has some persistently infected calves in them. And when we go back into the history, what we get a history of is just subtle changes. Again, a little bit higher death loss, from birth to weaning than we should have, but not catastrophic. A few more open cows than we should have, but not catastrophic. And that's oftentimes the history you get. Now, I've also seen some situations where, particularly if the herd is pretty naive, that you can have a lot of open cows and a pretty high death loss. But probably more common is a little bit more subtle than that.
Okay. Well, that's kind of terrifying, honestly.
It is.
You lose
yes.
the whole calf crop or something, and then you're in a whole year set behind and input costs. And I can see how the economic loss can really stack up really quickly. But back to the PI, I remember learning about this, or not. Clearly, I didn't learn it all the way because I'm asking you about it again. But I remember hearing about this and studying for it when I was in undergrad. But can you kind of explain the concept of a PI, or persistently infected animal, and like their role in BVD transmission, and just kind of all about PI?
And so the persistently infected BVD calf or PI animal is kind of unique for BVD, and it's both what makes the disease bad and also gives us a chance to control it. So a persistently infected calf was infected in utero, or while, during its dam's pregnancy. So the dam was exposed to the virus, probably from another persistently infected calf that, from the previous calving season or something else. So she's infected during pregnancy, and it's at a time when the fetus's immune system is just developing. So the virus infects the fetus, and this is not common for other viruses, but the fetus will see the BVD virus as self, meaning it doesn't build an immune response against it. So it allows the virus to multiply to very, very high levels.
Oh my!
And in reality, as you might expect, a lot of times that calf gets aborted, right?
Right.
And in some ways, that's maybe the best thing that could happen, because if he's not aborted, he will then go ahead and live, and then he will not see BVD virus as being a foreign virus. He sees it as part of himself, so he makes lots and lots and lots of copies. So he is able then to shed that virus at extremely high levels, higher levels than, if you say, viral particles per droplet of snot or something like that, way higher than we see for other pathogens. And so that's why it can be so bad, is these little PI calves are really virus factories, and they can produce a tremendous amount. The good thing, if there is a good thing about this, is because he became persistently infected in utero, and it's before his immune system really develops. If a calf is once a calf is born, they are either persistently infected or they're not, and they
Okay.
can never change characteristics. So if he's a PI, he's a PI for life. If he's
They can't
born not a PI, he can never become persistently infected.
because it's a genetic.
That has several. Yeah, that has some nice advantages, meaning that a once in a lifetime test can identify him exactly as persistently infected or not. So that's one. And usually we'll use one of the skin notch tests. And so we'll take a notch of skin, do that test, and it's not 100% accurate, but it's pretty accurate. And so if it fits with the history and the test, is used appropriately, basically an animal that tests negative, you can consider them negative for life, and an animal that tests positive, they're positive for life.
As a PI.
Right. So we've got other diseases that can cause lifelong infection once an animal becomes infected. BLV virus, anaplasmosis, even IBR virus, all of those will cause an animal to be infected for the rest of their life once they're infected, but they're infected after they've been born. So they could be 6 months old or 10 months old or 4 years old before they become persistently infected. That's not true with BVD. The day they're born, we know their status for the rest of their life.
So that doesn't mean they might still get infected with it, but they wouldn't be a PI at any point.
Exactly right. Then they're temporarily infected or transiently infected. And then again, this virus still has some immunosuppressive capabilities. It can cause abortion and those types of things. But we're talking a viral period of 10 days or less usually. And so versus a persistently infected animal is persistently infected for their life. And that's really important when you think about who's spreading it to other animals. So a temporarily infected animal can spread to other animals, but at so much less probability than a persistently infected animal. So most of our prevention focus and all of our testing is really focused on these persistently infected animals. If we are doing tests to identify those animals and get them out of the herd, and by doing that, we've gotten rid of by far most of the source of viral spread.
So your recommended source of management or management practice, if a producer identifies a PI animal, is just to say, you're out of here?
Pretty much. And that usually there's two options. One is euthanasia, which is common, particularly when they're young. The other is lifelong segregation, because, and again, I'll give you some generalities. If I've got a stocker operation that does some PI testing, so they're testing calves at arrival at a stocker operation, what we'll find is if we were to segregate all the persistently infected animals, many of them would die of respiratory disease or other problems within the coming weeks, but not all. Meaning that if I euthanize them all, which might be the best thing to do because they're likely to die, and in the meantime, they're going to require treatment, they're going to eat feed, they're going to require a lot of attention, but some of them don't die. Some of them can survive up till the time that they would be harvested or at least salvaged. And so some operations will choose to keep them segregated far away from the rest of the cattle and basically kind of allow Mother Nature to take its course and see which ones are really going to survive and which ones are not. So probably most common animals are euthanized that are persistently infected. That's not the only pathway, but it's probably the most common.
Gotcha. That's very interesting. And I had not thought about the fact of, testing all your incoming grass cattle, for that, but that's someone who has those, I'm now very interested in that. Especially as pink eye is ramping up. I'm dreading that. So, okay, so staying here on the PI animals, are there any herd management practices that can help prevent the development of those?
Yes, and the two really good tools, well, there's two or three tools, but I'm going to say two really important tools. Our vaccines are fairly effective. I mean, and actually quite good. The the limitations of our vaccine, so this would be making sure that your cow herd is vaccinated well going into the breeding season so that they're well protected during that early part of fetal development. Um, that is pretty good. The reality, though, is even when we do a whole herd vaccination program, different animals respond to the vaccine well or not. Younger animals tend to maybe not have as high of immunity as older animals. And the other thing is, if those animals are exposed to a persistently infected calf, because that calf is just expressing so much virus, that might be a big enough load to overcome a immune response that would be fine to protect the animal against a temporarily infected animal, but not sufficient to protect against this persistently infected. So we use our vaccines because they are helpful to raise herd immunity, to provide some level of protection, particularly against these exposure to a temporarily infected animal. And then we use our diagnostic testing, the skin tests of calves particularly, and the timing is important. If I can test all the calves, so you gave the scenario herd, we think they've got BVD. Maybe we've got a couple of these stillborn calves with the brain lesions, and so we know that BVD is circulating in the herd. If we were to go in and test every calf that has been born right before the start of the breeding season and identify all of those positive PI calves and remove them from the herd, probably euthanasia, remove them from the herd, we will have removed that pressure right before the breeding season starts. Now, the one other caveat to that is, I told you that once in a while those stalker calves, those grass calves, will live. Well, if that was a replacement heifer, most of them won't survive to be bred and go into the herd.
Okay.
But a few do. So if a persistently infected heifer happens to survive all the way to become pregnant and then survives through pregnancy, she will definitely have a persistently infected calf, right?
Okay. Makes sense. Yeah.
Most cows that have a persistently infected fetus, the cow herself is not persistently infected. She was just exposed during gestation and became viremic during that special stage of gestation when she created a persistently infected calf. So most PI calves, if I go and test their dam, she's not a PI. All right.
Okay. Yeah.
But I do that. If any calf that I find that's a persistently infected calf, I go test its dam because I want to find out. Again, I want to make sure that all persistently infected animals are gone from the herd before the next breeding season. That's going to be mostly calves, but just to be sure, I'm going to test the calves that are positives dams as well. And that way I can go. And this is the beauty of this disease, is because I can remove all of the persistently infected animals, calves and potentially any cows, before the start of the next breeding season with a normal vaccination program, that should protect them against most of any other types of exposure that they should have. And I can go from having a BVD problem 1 year to really eliminating that problem so I don't have it in the future.
And is it a 1 year? Is it an annual? I should know this. I'm sure we vaccinate for it, but I don't always look at the bottle. I'm just pushing cattle up the chute. Is it a lifetime, or is it like need to be done annually or biannually?
Yeah, we recommend basically annual boosters. Probably the most important is getting our heifers set up well. So make sure that, and usually I'm recommending 2 or maybe even better 3 doses of exposure to vaccine prior to their first breeding season, and then annual boosters after that is what I would consider appropriate for most herds.
Okay. So that's very good to know. Thank you. If a producer identifies animals in the herd, not PI, so we're transitioning back to I guess normal. It's nobody's watching me, but putting quotes normal. If they find a BVD positive animal, a normal one that's not PI, what treatments should they take to take care of that animal, but then try to control the spread of the virus throughout their herd? You mentioned segregating PI animals, but what's the process for just 1 or 2 that you?
Well, the pluses and minuses are a minus to the scenario you just gave me is, the test that we would use probably a blood sample, send that to the lab, and probably by the time we got our test results back, that calf would no longer be in viremic. And so we're not going to probably rely on diagnostic tests to identify those temporarily infected animals. But in a herd that's got some, we think there's PI animals in there, so there's probably also some temporarily infected animals. Then you just use kind of good spread animals out, segregation, identify sick animals immediately, isolate them away from others. And then because it's a virus, antibiotics don't really directly affect the virus, but because it's immunosuppressive, sometimes I'm worried about bacterial infections that might come in behind it. So basically just good nursing care and being aware of other diseases that might come along with this problem.
So, okay, that's good. I mean, that's all really good information. And I'm glad you're touching on that. You were mentioning earlier at the very beginning of the episode, you're talking about there's can be abortions, and that is kind of maybe your first clue or whatever, can be a clue that you've got BVD. Is there like not any numbers around like death loss specifically related to BVD, or can the death loss not only of calves, but of like all segments, cow, calf, stalker, all segments be, is it all related to the BVD, or is it some of it being attributed to the underlying issues that are coming on because of BVD? Are there any numbers around that? I guess.
And the numbers vary. Yeah, the numbers vary greatly because probably the underlying health and immunity of the herd where we're seeing the problems. The biggest problems I've seen have been in some relatively isolated herds that didn't, have a kind of a routine vaccination program, and so that the herds were pretty naive. And when it came in, probably the worst case scenarios I've seen is, I'm going to ballpark this a little bit, but maybe 30% or more open cows versus what I expect would be 5 or 10 at the most, just from a normal herd. So substantially more open cows, and usually associated also with some additional death loss, so that our overall weaned calves per cow exposed would be
is just lower,
very low, approaching 50%, which is catastrophic. That's the worst case scenario. And in a university position, I get called in on some of those, so I get to see them sometimes. That's actually pretty rare. What we're tending to see is, say, if you run a herd where on a year in and year out, you're running about 5% open cows, it could be 2-3 percentage points more. So again, not so devastating that it's obvious you have a problem, but because of the development of PIs, then you're going to maintain that pressure year after year, and you'll probably always be just a couple of percentage points below where you ought to be if you could get rid of this virus. Kind of the same thing on calf health. National averages are 2-3% death loss between birth and weaning, and particularly past the first 48 hours or so. And with a BVD problem, and again, in a naive herd, it might be substantial death loss in calves. What I'd really expect to see is 2 or 3 percentage points more than what I typically have, which again becomes very frustrating economically and as a producer. Not so devastating that it's obvious you have a problem, so it's easy to kind of not notice. And so that's why a lot of times when we do find these PI animals for one reason or another, and we go back to the cow-calf herd where they originated, and we kind of clean that up, it's not that you made a night and day difference in health, but things get a little bit better, and cows breed up a little bit better.
Yeah, I mean, 2 to 3%, that doesn't sound like a lot. On a herd of 100 cows, that's 3 head, but it's 3 head every year, and if your herd is bigger than that. So, I mean, little things add up like that. And in a business with tight margins, obviously little things matter. So kind of swinging the pendulum back the other way, if somebody's just not going to vaccinate, they don't monitor it, and they're not managing it, like what's the consequences, we kind of touched on that, is basically you're just going to be doing a little bit worse every year if you're just not doing anything about it.
Right. Because one of the things that we do know is you will build some herd stability. The cows are being exposed to BVD virus throughout the year if there's PI calves in there. And so they'll build pretty strong immunity. That's a pretty good vaccination, is to be exposed to the virus from these persistently infected calves. And so the herd immunity actually becomes quite good.
Okay.
But you've also got these PI calves that are very high exposure. So those few animals that don't have quite a good immunity, they'll just always stay susceptible. And that's why, again, in a herd that has a BVD problem, if you did nothing this year and probably next year, noticeable problems. And then you kind of get to this stability where you're not quite as good as you ought to be, but it's not a disaster year after year after year.
That's definitely interesting. So I think I know the answer to this, but we're just gonna roll with it. But why does persistent BVD cause such significant economic losses? And are there any numbers that you know of that can that attempt to give an economic outcome of like how much it's costing the industry as a whole every year?
I think one of the reasons that BVD gets the attention that it deserves is because it can cause harm at different sectors. So picture a scenario where you've got a few more open cows, you have a few more calves that die at birth or are stillborn, you have a little bit higher death loss between birth and weaning, and then once we've sold those calves and they go into a stocker operation or a feedlot operation, again, we have some more harm. Those losses start to accumulate. And then the other thing about once we've left the cow-calf operation, now remember I said that you'd build some stability, some immune stability in that herd because they're exposed all the time. Well, when I take those calves, if there's a couple of PI calves and I sell them into the marketplace and they get commingled with other cattle that don't have this, they haven't been in a herd that's been exposed to BVD, maybe vaccinated, maybe not, but then I'm exposing them at a time when we're doing transit, changing their diet and other things. So at the stocker and feedlot phase, we may see increased, viral shed, and then a lot of temporarily infected animals just at the time when they're at susceptibility for bovine respiratory disease. And so that's another place where we've gone beyond the cost of the PIs themselves. We're causing some abortions, we're causing some herd mates to have greater death loss. And then as we go into marketing channels, when we commingle, and again, some of the calves I might commingle them with would have pretty good immune response and wouldn't be devastated, but other groups might be pretty susceptible. And I put a PI calf in that population and we can have some serious collateral damage.
Yeah, it's kind of that movie. It's a Dustin Hoffman movie from like the late 90s. I think it's called Outbreak or something like that.
Yes.
And yeah. Good movie, relevant. It sounds like that, what leaves there, if it leaves your farm or your ranch, you don't know what's happening after it's gone. So that's, that speaks more to, just further speaks to why it needs to be handled, I guess. It sounds very doom and gloom. Are there any bright spots on the horizon for, I don't know. I mean, is this going to be the status quo for the next 5 decades of it? Or what do you think?
I think in some ways, yes, these viruses are very good at sustaining themselves. And so completely eradicating this virus is quite challenging. A few countries have done it that had relatively small. Some of the Scandinavian countries have actually instituted, aggressive testing and removal and basically eliminated the virus from their countries. We have such a large industry. And I didn't mention before, it can also have, in fact, white-tailed deer. It seems like deer can carry so many things, which
there's no deer around. Never in this acid.
Deer and elk aren't particularly good at transmitting the virus, but they can. And so eliminating it in this country is probably not a good use of resources. But for a individual farm or ranch, I think some of the things that you do, so I'm going to talk cow-calf, is a good vaccination program that includes BVD virus, which many ranches would be using. And that really decreases your risk greatly. Really monitoring any additions that you bring into the herd. So that would be replacement heifers and even bulls. And again, bulls are kind of like older heifers. They're not likely to be infected because these PI calves, many of them will, because they're also immune suppressed. So they suppress other calves with their virus. Well, they themselves are also immune suppressed. And so it's very common for them to not survive to weaning, or if they do survive to weaning, it's very common for them not to survive later. But there's always a few exceptions. So a rare yearling bull that's a PI, a rare replacement heifer that's a PI. So that's why we test those populations. I don't expect to get very many positives, but I don't want to miss them either. So we test animals that we bring onto the herd. We have a good vaccination program. And then the other place where we do see some issues is which cattle are on fence row contact with our breeding herd. So again, stocker cattle that might come in from many different herds, having fence line contact with my breeding herd, I would try to avoid that. Not always easy to accomplish, but being aware of, when the cows are not pregnant, or when they're late in gestation. There might be other reasons to also avoid that. So be aware that, and it's not, yes, the virus can cross the herd or cross the fence, but so can cattle. And so I don't want a persistently infected stocker calf to get through the fence and get in with my pregnant cows. And so vaccinations, testing of animals we bring into the herd, and some fence line controls, particularly thinking about during the breeding season.
So this is relevant. I'm very intrigued by this because I had a bull jump fence today, and that's what I was doing before this, getting the bull back. And we also run grass cattle and cows, and they don't run together, but they do follow each other in a rotational grazing system. But if the herd is vaccinated and you had a stocker that, you had one, you had a steer that was infected, and your cow herd is vaccinated against it, I mean, are you going to be pretty closely protected on that? Like pretty safe if they're all vaccinated?
And I wish I could give you definite numbers, but let me say it this way. If that's one of those temporarily infected animals, meaning that they're going to be viremic for 7 to 10 days and at a level that's much less than a persistently infected animal, I'm kind of counting on my vaccines to protect me against that. And I think they do a very good job of protecting me against that kind of exposure. If that steer that jumped over the fence was a persistently infected animal, I think the vaccines would definitely decrease the number of animals that we might have problems with, but it probably doesn't take it to zero.
Okay.
And so
that's very interesting.
That's kind of my, maybe a little bit of a wishy-washy answer, but
no, I don't think
our vaccines are helpful, but they are challenged by these persistently infected calves. If you have persistently infected calf in close contact, particularly for several days, that's a challenge.
Okay, that's very helpful. I'm writing that down so I have to look. So thank you for that. I feel like we have kind of talked at length, but I'm sure that there is just oodles and oodles more to talk about with BVD. I want to be cognizant of your time. Is there anything about BVD particular, or maybe just anything that we didn't touch on and you want to really make sure that our audience hears that's a takeaway that I neglected to steer us towards? Is there anything like that?
Well, I think we have covered a lot of the important things. I guess maybe just the double-edged sword part of this disease is it can be pretty devastating, or it can be just kind of a drippy faucet, annoying, low-level loss, and it affects basically no aspect of the beef industry or even the dairy industry is immune from this completely. But we do have good tools. That the test of PI animals is unique because it's a lifetime test. If they're negative, they're never going to become a persistently infected animal. So which allows us to be pretty aggressive with culling, because if an animal is positive, we can cull them. We can greatly reduce the exposure to the rest of the herd. So we have some tools that, as bad as this disease can be, we've got pretty good tools for this disease. And so as a veterinarian, I feel like I can come in and really help a herd and change the situation. Whereas many other diseases we talked about that have persistently infected carriers, we'll always kind of be battling those over time. And this is when I think I can win the battle. Now, it might come back later, but I can win the battle in the short term.
But it's a battle, not a war. So that's encouraging to hear that we can win a battle. Because sometimes
it is encouraging once in a while.
Yeah, I feel like there's a lot of battles that we just maybe are never going to win. So having a notch on our belt, that makes me feel good. I told you at the beginning of this, before we actually went on air, that I wasn't going to ask you the beef resource book or anything like that. But I do want to ask you, as we ask all of our guests, what is a book that is not related to beef or cattle that you're reading right now that you would recommend to our audience? This is the only rapid fire question one I've got for you today. Is just this one book.
So one of my guilty pleasures is I like mystery books, mystery novels. And I just stumbled upon a series by Margaret Allingham, Allingham, Allingham. And I'm only on the second book, and she's got a bunch of them, and I'm really kind of enjoying them. They're a lot of fun. So that's my new series that I've gotten started on.
Mysteries by Margaret Allingham. Gotcha. My daughter is 6. She's using my library card this summer, and she is super big into Scooby-Doo mystery books right now. So you guys have that in common. She just finished the creepy cowboy caper.
Yeah, there
So
you go. She's on the path towards a lifelong of mysteries.
yes, she is. That's great. Well, thank you for sharing that with us. And thank you again for coming on the show. That is all the time we have today. But thank you for being with us again here today. I know that you're very busy, but we so greatly value your expertise and your advice for our producers and our audience. If people want to find more information about you or your work or the Beef Cattle Institute Cattle Chat podcast, which I didn't mention enough, but Dr. Larson does host the Beef Cattle Institute Cattle Chat podcast. Where can they do that? Where can they find you?
Well, the Beef Cattle Institute website is probably the best place to find information about me, some of the things that the research group that I work with are doing, as well as, some other articles and things like that. So if you Google Beef Cattle Institute, you'll end up at the right site.
Okay. Well, that sounds great. I'm going to make sure that we have that in the show notes so that people can find that. And again, you can find the podcast. Is it on like wherever you get podcasts?
Absolutely.
Apple?
So wherever you get, iOS, any podcast service, Cattle Chat is the name of the podcast. So look for Cattle Chat.
Great. Well, thank you again for that and for your time. That is all the time we have here today. So thank you all for joining us. Dr. Larson, thank you for being here. And to our audience, we hope you'll join us again next week on the Beef Podcast Show.